Dissociative disorders is a fascinating and complex group of psychiatric conditions that disrupt consciousness, memory, identity, and perception. Understanding these disorders is crucial for our nursing practice, as they often manifest in individuals with a history of trauma or extreme stress. Dissociative disorders involve a disruption in consciousness, memory, identity, or perception. These disruptions are not due to substance use or any medical condition, but are instead psychological responses to extreme stress or trauma. Think of dissociation as a psychological escape mechanism. When someone experiences traumatic event such as abuse, violence, or war, the mind sometimes disconnects from reality as a way to cope. This is similar to how people zone out or feel detached during high-stress situations. But in dissociative disorders, this reaction is prolonged and significantly impairs daily life. For example, a person might suddenly forget personal information or feel as though they are watching themselves from outside their body. In severe cases, individuals may even develop entirely separate identities. The onset of these disorders can be sudden or gradual, and they may last briefly or become chronic. Now let's take a look at the different types of dissociative disorders. We have the dissociative amnesia. This is characterized by the inability to recall important personal information and is often related to trauma. This amnesia is too extensive to be explained by normal forgetfulness. A specific type, called dissociative fugue, occurs when individuals unexpectedly travel away from home and assume a new identity with no recollection of their past. They may suddenly wake up in another city with no idea how they got there. A classic example is a case where a woman disappeared from her home in New York and was found months later in California, living under a different name and identity. Previously known as multiple personality disorder, dissociative identity disorder, or DID, is perhaps the most well-known yet controversial dissociative disorder. It is characterized by the presence of two or more distinct personality states, often referred to as alters. Each alter may have a different name, age, voice, and even mannerisms. These personalities take turns controlling the person's behavior and may have gaps in memory between switches. DID is often linked to severe childhood trauma, particularly repetitive abuse. One famous case is that of Sybil, a woman who reportedly had 16 different personalities, each with unique characteristics and memories. Although later questioned, her case brought significant attention to DID. The depersonalization or derealization disorder involves persistent episodes of either feeling detached from one's self or depersonalization, or feeling that the environment is unreal, or derealization. Patients often describe feeling like they are watching themselves from outside their body, or that the world around them seems distorted, dreamlike, or artificial. Unlike psychotic disorders, individuals with this condition remain aware that their perceptions are altered, but they cannot control it. For example, there was a college student who has been under extreme stress during exams, and she suddenly felt as though she was observing herself from above, as if in a movie. The primary cause of dissociative disorders is psychological trauma, often during early childhood. It could include severe physical or sexual abuse. Many patients with DID, for example, report histories of prolonged abuse, which led to the mind doing what you would call as fragmentation as a coping mechanism. Or during combat, natural disasters, or severe accidents. This can also trigger dissociative symptoms in adults. There were controversies in the diagnosis. Some professionals believe that DID is overdiagnosed due to suggestibility in therapy, while others argue that it is underdiagnosed due to a lack of awareness. The main form of treatment for dissociative disorders is psychotherapy, which includes reassociation therapy. This helps patients integrate dissociative memories and identities. Cognitive behavioral therapy, or CBT, is used to help individuals manage anxiety and recognize maladaptive thoughts. Group therapy. This provides social support and reduces isolation. There is no specific medication to cure dissociative disorders, but drugs like antidepressants and anxiolytics can help manage depression and anxiety that often accompany these conditions. As nurses, we play a crucial role in the care of patients with dissociative disorders. A thorough assessment should include cognitive function and memory recall. Does the patient experience gaps in memory? Emotional support. Are there signs of anxiety, depression, or anger? Behavioral observations. Are there indications of identity switching or dissociation? Nursing interventions include ensuring safety. Patients with dissociative disorders, particularly those with trauma histories, may be at high risk for self-harm or suicide. Always assess for suicidal ideation. Use grounding techniques. Encourage patients to stay connected with their present surroundings. Simple techniques include holding a cold object, touching textured surfaces, or describing the environment aloud to bring them back to reality. Build emotional support. Teach relaxation techniques, journaling, or mindfulness to help patients manage dissociation. Educate families about recognizing dissociative episodes and responding with patience and reassurance. For expected outcomes in the short term, we aim to reduce anxiety and distress through coping strategies. Improve sleep patterns and self-awareness. In the long term, success is measured by the patient being able to express emotions and memories in a healthy way, and the patient learned or developed the ability to function in daily life without significant dissociation. With the right care, individuals with dissociative disorders can achieve stability and improve their quality of life. To summarize, dissociative disorders arise from trauma and disrupt key aspects of consciousness, memory, and identity. Treatment focuses on therapy, symptom management, and coping strategies, while nurses play an essential role in ensuring safety, providing emotional support, and teaching grounding techniques. Understanding these disorders help us provide compassionate, evidence-based care to patients who have endured severe psychological distress.